Hello, my dentist friends on YouTube. I have a question for you. Why would you alter the vertical dimension for your patients? Why would you do this? Why would you alter and change the vertical dimension? Um, what's the reason for this? And let me share with you some insight. I've been practicing for 25 years and I've been treating pretty significant wear patients since the 1990s. Patients like this, pretty significant tooth wear. There's a reason to alter the vertical dimension for a patient like this. There really is. Let me tell you what the reasons are. There's basically two reasons. So when you have a patient like that, here is his before clinical photo. And in a case like this, when the patient closes, you can see the amount of tooth wear on the lower incisors. It's similar on the upper incisors. When he closes, there's no room for restorative material. There's no room here to restore these teeth when there's that much tooth wear and without mutilating the teeth by preparing them any further. His teeth are prepared enough from the tooth wear. They don't need more preparation. So to restore his dentition, we need room for restorative material. And so we have to alter the vertical dimension, be it restoratively or orthodontically or orthodontics plus orthognathic surgery. It depends on the case. We do all different techniques. For this particular patient, he did not want orthodontics. He declined. So we did restorative alteration of the vertical dimension. And in his case, it was a full mouth rehabilitation. So you can see here's the before and the after images. And if you look at him closed, here's the before image, quite a deep overbite. And here's the after image. We have created a better occlusion for this patient, and we haven't mutilated the teeth by preparing them. These teeth did not have room to prepare them on the palatal of the upper or the facial of the lower. There was just no room for that. And so obviously we went through the whole process and all the systems, and we did a diagnostic wax up, which is represented here. And there is a predictable system to figure out what change to make to the vertical dimension. And I'll share with you some ideas about that in a sec. Another reason to alter the vertical dimension for a wear patient especially is to lengthen the upper teeth. So a lot of people with tooth wear would like their upper teeth lengthened. So they'd like longer upper teeth, better smile. Some of these people, quite a few actually, that I've found over the years, as their teeth have worn, they've developed basically wear in the contacts. Also, the teeth have moved a little bit lingually, and the patient develops an end-to-end worn out occlusion. So they've gone from having maybe a little bit of overbite and overjet to now having an end-to-end anterior relationship. If the patient has an end-to-end anterior relationship and they want longer teeth for an improved smile, how are you going to do it? You have, again, no room for restorative material. So this is another reason to alter the vertical dimension. Again, orthodontically, orthodontics plus orthognathic surgery in some cases. Restoratively, this could be done restoratively as well, or a combination of all three. In this particular case, the patient declined orthodontics, but he had tooth wear and erosion on all of his teeth, so he was a good candidate for another full mouth rehabilitation. We went from an end-to-end occlusion to an occlusion that developed some overjet and overbite and a better functioning occlusion. And most importantly to the patient, longer teeth, better smile. So that's this particular case. If you look at the close-up, his teeth wanted to be about 2.5 to 3 millimeters longer on the central incisors, and you can see the difference. We had no room to make that happen. So the two reasons we want to alter the vertical dimension is to create room for restorative material and to create room for restorative material to lengthen the teeth when the patient has an end-to-end type of occlusion. So it's really to create room for restorative material, either just to restore worn out teeth that shouldn't be prepared any further, which would mutilate the teeth. Having a hard time saying mutilate today, don't know why. Or to add room for restorative material to lengthen the teeth. So those are two good reasons to alter the vertical dimension. So, whether or not you're physiologically altering the vertical dimension, or you're just changing the tooth position relatively without changing the contracted length of the elevator muscles, that's an interesting discussion to have. And relative to figuring this out with an articulator and with bite records and all of those things, I would suggest that it might be fun for you to join my online seminar, Altering the Vertical Dimension Case Studies, where I will share with you a system to alter the vertical dimension, and it's helping gain room for restorative material. So it's an interesting system that I've developed and used over the last, I'd say, 20 years. And I would suggest that all of us have patients in our practices that suffer from tooth wear. All of us have patients in our practices that suffer from tooth wear. So if you're interested in this kind of dentistry, click the link associated with this video, and you'll be sent to this page, which is the registration page for my free online clinical training seminar for dentists. This is designed for dentists, not for patients. If you're a patient, you can come into the practice, we could have a consultation and talk about this, but this seminar is really clinically oriented for dentists. So once again, click the link associated with this video. We'd love to have you join us for the online seminar, and it's a very interesting, detailed clinical training about altering the vertical dimension. And so if you like this kind of dentistry, join us, and I'm looking forward to connecting with you very soon. Thank you.